Good evening, folks. Now, for discussion C, we're going to talk about the different phases of transitioning somebody either from hospital to home or from hospital to rehab, or to explain care more effectively until they are able to go home again permanently. Okay, so we're going to go through the transitional care phases. So please join me in tonight's discussion C, transitional care phases. Okay, guys, give me a second to reposition here. Okay. A detailed guide for families, caregivers navigating transitions between hospitals, rehab, skilled nursing facilities, assisted living, and eventually back home. Here's a breakdown based on the full page content. Okay, first, core focus. The article emphasizes that caregiving transitions are often abrupt and emotionally taxing, but with planning, communication, and advocacy, caregiving can ease the process and improve outcomes. Key strategies for managing transitions. 1. Plan early at hospitals Plan early at hospital admission. Okay. 2. Don't wait until discharge. Engage a discharge planner or social worker early. On to coordinate care, transportation, insurance, and post-discharge needs. This includes arranging home care services or touring potential facilities if home isn't viable. 3. Advocates. Relentlessness. You must be the only consistent link between care settings. That means tracking medications, ensuring medical records transfer properly, confirming discharge readiness, and pushing back if discharge feels rushed. Insist on the 3 I's. Information, fully written summaries, medication lists, and follow-up plans. Folks, you have to have those in place in order for the transition to work right. Okay? You must have those in place. Inclusion. Ensure you're part of care planning conversations. C, instruction. Okay. Get practical hands-on training for post-discharge care tasks like wound care, medication management, or feeding tubes. 5, select the right facility thoughtfully. Visit options based on services, staffing, hygiene, visit policies, and proximity. A surprise visit can offer more honest picture, rehabilitation, and socialization. Okay, and then we've got 6. 6 is transitioning home. Access your loved one's readiness. Assess your loved one's readiness for independence. Ask about red flags. Follow up, appointments, requirement, and home modifications. Ramps, grab bars, or oxygen tanks. Okay, those things matter. Okay, secure home-based care as needed, and clarify what's covered by Medicare or Medicaid. Get real about the future. Sometimes hospitals overestimate a family's capacity to provide care. Be honest about what you can handle and explore paid support if needed. Being a good caregiver doesn't mean doing it all. It means coordinating a system that works. Okay, 8, care for the caregiver. Emotional and physical strain are common, especially during transitions. Rest, supports, and moments of self-care aren't indulgent. They're necessary to sustain caregiving long term. Okay, guys, like I said in the other video, take 5 or 10 for yourself if you need it. If you are a caregiver for somebody, take 5 if you need it, or 10 minutes. I'm sure your client or someone is not going to scream at you for taking 5 or 10 for yourself. Okay? The article reinforces your holistic and systematic approach. It's about thoughtfully aligning patient needs, practical care delivery, and caregiver well-being. Would you like a printable checklist version, or maybe suggestions for how to integrate this into a patient education toolkit? Absolutely. Here's a practical and caregiver friendly checklist to help manage transitions between hospitals skilled nursing, rehab, and assisted living, and then home. Okay, caregiving transition checklist. At hospital admission, request a case manage request a case manager discharge planner early. Start discussing discharge expectations and next steps. Ask if rehab/skilled nursing will be needed post discharge. Okay. Then you have before discharge. Confirm medical stability or discharge review within full written discharge summary and care plan. Those are very crucial for folks. Okay. Request medication list and explanations if any changes. Get hands-on training, wound care, feeding tubes, medication setup. Ask about follow-up appointments and providers. Facility selection if needed. Visit rehab skilled nursing / assisted living options in advance. Evaluate staffing, cleanliness, communication, and policies. Ask how they handle transitions and community care community. Okay. Ensure they're covered by insurance or Medicaid if applicable. Okay, then you have transitioning home. Assesses for equipment needs, hospital, bed, walker, oxygen, etc. Arrange home modifications, grab bars, ramps, etc. Confirm home health services, nursing, PT aides, etc. Okay, verify who will coordinate appointments and medication refills. Okay, then we're going to go into ongoing care planning. Okay, schedule all follow-ups and therapies promptly. Releases the care plan regularly. Adjust if needed. Change. Okay. Be honest about your own capacity as a caregiver. Explore additional help or respite care if needed. Caregiver support. Here you go, guys. I'm going to go through those for you. Caregiver support. Take time for yourself and rest. Join a caregiver support group. Know your limits. It's okay to ask for help. Okay? Instead of burning out, folks, ask for help. Keep a journal or app. Track care details and feelings. Would you like this checklist in printable format or tailored to a specific condition like post-stroke care or dementia? Absolutely. Choosing the right facility, whether it's rehab, skilled nursing, or assisted living, is one of the most impactful decisions in a transition. Here's how to approach it with clarity and confidence. Key factors for selecting a high quality care facility. Okay, services and specialties. Folks, you have to check into all of this for your loved ones. Okay? Make sure they offer the types of care your loved one needs, e.g., stroke rehab, memory care. Ask how they coordinate with hospitals and outpatient providers. Okay. 2, staffing and ratios. Inquire about staffing credentials, turnover rates, and caregiver to resident ratios. Meet key staff members if possible, particularly nursing and therapy teams. Cleanliness and environment. Look for good lighting, fresh smells, and clean common areas. Notice resident engagement. Do people seem active, comfortable, and well cared for? 4, family involvement. Are families encouraged to participate in care planning? What's their policy on updates, visitations, and family feedback? 5, emergency and medical protocols. Ask how they handle medical emergencies or overnight changes in conditions. Okay, confirm their 24-hour nursing coverage or physician on call. 6, activities and socialization. A good facility supports emotional and cognitive well-being with recreation, therapy, and social interaction. Ask about weekly activities and tailored programs. 7, license and compliance. Verify their license is up to date. Check ratings via Medicare, Compare, or state health department reports. Research for compliance, cautions, and ask how issues were resolved. Okay. 8, insurance and costs. Confirm what is covered under Medicare, Medicaid, or private insurance. Ask for a breakdown of private pay rates and extra fees. Proximity and logistics. Consider travel time for family visits. Ask how they handle transportation for appointments or emergencies. Okay, 10 is gut check, guys. If it doesn't feel right, trust your gut. Because I guarantee you that facilities all have to be up to date. If something seems off, check into it before you put a loved one in there. That's my FYI for that one. Okay. Hold on, I'll finish this. Trust your instincts. A surprise visit during off hours, e.g., evenings or weekends, can be revealing. Would you like a side-by-side comparison or template to help compare facilities, or one tailored for a specific condition like memory care or post acute rehab? When you're evaluating care facilities during a transition, a few key factors tend to have the greatest impact on safety, community, and recovery. Based on the page content and your deep understanding of patient-centered care, here's what deserves top billing. Okay, top priorities when choosing a care facility, folks. Clinical capabilities. Do they specialize in your loved ones? Do they specialize in your loved one's condition, i.e., stroke, rehab, memory care? Are licensed nurses and therapists available on site or 24/7 care? Community of care, continuity of care. How well do they coordinate with discharging hospitals? Is there a clear plan for communication and medication management across settings? Staffing qualify and ratios. Let's see. Suitable, skilled staff, better outcomes. low turnover and reasonable nurse to resident ratios often signal strong internal culture, infection control, and safety, especially post pandemic. Ask about hygiene practices, outbreak history, and emergency protocols. Family inclusion. Are you involved in care planning and updated regularly? Can you visit easily and access staff when questions arise? Environment for healing. Is the space calm and clean and equipped with mobility aids or rehab areas? Our social and cognitive engagement activities offered daily. 7. Reputation and transparency. Review Medicare ratings, compliant records, and state inspection reports. A good facility won't shy away from sharing data or answering tough questions. Coverage and costs. Confirm what is covered by Medicaid, Medicare, or private insurance. Watch for hidden fees on services like physical therapy or transportation. 9. Logistics. Proximity to family and primary care providers can simplify follow-up appointments and advocacy. 10. Your gut feeling. Surprise visits can reveal more than a brochure. Trust your instincts after observing staff, residents, interactions, and daily rhythms. These criteria blend clinical rigor with your own capacity to stay involved. If you'd like, I can help create a weighed decision matrix or walk through tailored to rehab memory care or post acute settings. Want to go deeper on one of these factors? Of course. Happy to break down each creation. A facility decision matrix holds this distinct weight because it impacts different aspects of a person's recovery, autonomy, and caregiver burden. folks. All right. Here's how they stack up in terms of significance. 1. Clinical capacities or clinical capabilities. Why it matters. The facility must match your loved one's medical and rehabilitation needs. Specialized care for dementia, stroke, Parkinson's is crucial for meaningful or critical for meaningful recovery and preventing complications. Staffing quality and ratios. Why it matters. Staffing levels directly affect attention, safety, and outcomes. High staffing turnover or low staffing ratios often correlates with missed care, burnout, or more hospital readmissions. Family communication and inclusion. Why it matters. Facilities that actively involve families foster better care, coordination, increase trust, and can spot decline sooner. You're not just a visitor, you're part of the team. Cleanliness and safety. Why it matters. Clean environments reduce infection risk and signal attention to detail. Ask how they handle fall prevention, wandering, or medical equipment safety, especially critical post discharge. Rehab and cognitive engagement. Why it matters. Access to physical, occupational, speech, or cognitive therapy supports recovery and delays further decline. Daily activities reduce isolation and support mental health. Okay, location and logistics. Why it matters. Proximity affects how often loved ones can visit or advocate for in person. Being nearby also makes it easier to coordinate care and respond during emergencies. Okay, 7, cost and insurance coverage. Why it matters. Out of pocket surprises can derail care community. Knowing what's covered, what is not, and whether the facility accepts Medicaid can determine whether the plan is suitable. Okay, reputation and transparency. A facility's track record, e.g., uh, through state inspection reports, Medicare Care Compare, and community feedback, gives insight into consistency, compliance, and how they address problems. Each uh, criterion is a lens for risk management and quality assurance, especially during vulnerable, especially during transitional care moments when patients are vulnerable. If you're tailoring a matrix for a specific condition like dementia, stroke, or post surgical rehab, I can help you uh, re- reweigh these for better alignment. Okay. Last page. Would you like a filled out example matrix using a functional facility based on a real comparison you're considering? Okay, guys, so those are tonight's shows. I will see everybody tomorrow for shows. For now, Gator Wellness, take care, folks.